In society, we kind of have a certain opinion in our minds of what a normal shape of a breast should be. That's the ideal. Now, in nature, there are a lot of things that aren't quite ideal. And genetically, unfortunately, the breast can take on a number of not so typical appearances. One of those is a tubular breast deformity. This is a deformity that starts when you start to develop as a teenager and usually reaches its peak or so at the end of our high school years, and then just maintains its irregularity throughout your life. And unless we do something to correct it, nothing changes. The tubular deformity is a situation where the majority of the breast tissue is focused in or behind the nipple area. And it can be a deficiency of breast tissue throughout the rest of the breast, or it may just be that it's focused more so in that area but some in the other areas. And even less fortunately, it can be one side and not both, or it can be both. It's never one specific appearance. And we can have certain degrees of it as well. Now, correction of that does require a surgical procedure. If it's a deficiency of tissue overall, an implant is usually involved to fill out that area that's constricted. Also, if it's extra tissue in the nipple and extra nipple skin, some form of a lifting procedure is necessary too. If it's simply the areolar area that has extra skin, then we can do what's called a donut or Benelli mastopexy. This requires an incision all of the way around the nipple, and we take a ring of the skin, take that away, and then we bring in the edges to make a smaller nipple that's more flattened and has a more normal appearance and in a better position or location on the breast. If it involves both extra nipple and extra skin, especially along the lower area of the breast, then we have to do more of a full lifting procedure, and we utilize kind of the anchor type incision, and we move the nipple up, bring it to a smaller size, and also take away skin on the lower part of the breast. And a lot of times it requires a slightly different technique from side to side to get things as even as possible. The answer is there is at least something we can do for it. Most women have some asymmetries no matter what, but if you realize that yours is a little more severe, then realize there at least is something that we can do to improve it.